In the realm of heart health, advancements in medication have offered hope and extended lifelines to those grappling with heart failure. One such beacon of progress is Entresto, a prescription medication that has garnered attention in the cardiovascular community. My journey into understanding Entresto began when a family member was diagnosed with heart failure, a condition that affects millions worldwide, leading to a quest for reliable treatments. Through comprehensive research and discussions with healthcare professionals, I've gathered insights into Entresto's applications, benefits, and the caution needed when navigating its use. Introduction to Entresto. Entresto represents a significant evolution in the management of chronic heart failure. It emerged on the pharmaceutical scene as a novel combination drug, primarily designed to improve heart function and reduce the strain on the failing organ. Comprising sacubitril and valsartan, Entresto operates by enhancing the protective neurohormonal systems of the heart while simultaneously suppressing the harmful effects of the renin-angiotensin-aldosterone system, RAS. This dual-action approach marks a departure from traditional heart failure medications, offering a glimmer of hope for those battling this debilitating condition. Understanding the significance of Entresto requires a deep dive into its mechanism of action. Sacubitril works by inhibiting neprilysin, an enzyme responsible for breaking down natriuretic peptides, thereby allowing these peptides to exert their beneficial effects on the heart, including vasodilation and sodium excretion. Valsartan, on the other hand, blocks the action of angiotensin II, reducing vasoconstriction and aldosterone secretion. Together, these components of Entresto work in concert to alleviate the symptoms of heart failure, improve survival rates, and enhance the quality of life for patients. The FDA's approval of Entresto was a watershed moment, heralding a new era in heart failure management. Clinical trials, most notably the PARADIGM-HF trial, showcased Entresto's superiority over enalapril, a standard ACE inhibitor, in reducing the risks of death and hospitalization due to heart failure. These findings have propelled Entresto to the forefront of heart failure treatment, making it a cornerstone therapy for many patients. Common applications of Entresto. Entresto's primary application lies in treating heart failure, specifically chronic heart failure with reduced ejection fraction, HFrEF. Patients diagnosed with HFrEF experience a diminished capacity of the heart to pump blood efficiently, a scenario where Entresto has proven to be particularly effective. Its role in the management of heart failure is underscored by its ability to slow the progression of the condition, offering patients a chance at a more active and fulfilling life. Beyond its primary indication, ongoing research and clinical trials are exploring the potential of Entresto in treating other forms of heart failure, such as heart failure with preserved ejection fraction, HFpEF. Although the evidence is still emerging, the versatility of Entresto's mechanism offers hope that its benefits could extend to a broader spectrum of heart failure patients. Additionally, its potential applications in post-myocardial infarction recovery and in certain cases of hypertension highlight the expansive horizon of Entresto's therapeutic reach. The adoption of Entresto in clinical practice has been guided by evidence-based guidelines, which recommend its use as part of a comprehensive heart failure treatment regimen. These guidelines, formulated by leading cardiovascular organizations, underscore the medication's importance in improving clinical outcomes for heart failure patients. As more healthcare professionals integrate Entresto into their therapeutic arsenal, its common applications continue to evolve, shaped by ongoing research and real-world patient experiences. Benefits of using Entresto. The benefits of using Entresto for heart failure patients are multifaceted, encompassing both clinical improvements and enhanced quality of life. At the forefront is the medication's ability to significantly reduce the risk of cardiovascular death and heart failure-related hospitalizations. For patients and their families, this translates into more precious moments shared and fewer disruptions caused by acute health crises. Entresto's impact extends beyond mere survival rates. It also improves symptoms of heart failure, such as breathlessness and fatigue. Patients often report a noticeable improvement in their ability to perform daily activities, a change that can profoundly affect their overall well-being. The psychological uplift from feeling better cannot be understated, as it fosters a more positive outlook on life and disease management. Furthermore, Entresto has been associated with a reduction in the severity of heart failure, as evidenced by improvements in biomarkers like N-terminal pro-B-type natriuretic peptide, NT-proBNP, levels. These biological markers provide a window into the disease's progression, and improvements in these indicators often correlate with better patient outcomes. Additionally, the medication's favorable safety profile, when compared to traditional therapies, adds another layer of benefit, making it a suitable option for a wide range of patients. Potential adverse effects of Entresto. While Entresto offers a beacon of hope for many, it's imperative to acknowledge that no medication is without its potential drawbacks. Adverse reactions can occur, and being informed about these possibilities is crucial for patients and caregivers alike. Among the most commonly reported side effects are dizziness and hypotension, which are generally manageable but can be concerning, especially in the initial stages of treatment. Another significant concern is the risk of angioedema, a rare but serious allergic reaction that causes swelling of the deeper layers of the skin, often around the eyes and lips, and sometimes the throat. Patients with a history of angioedema related to ACE inhibitor or ARB therapy should exercise caution when considering Entresto, underscoring the importance of a thorough medical history review before initiation. Kidney function and potassium levels are other areas where Entresto can have an impact. Monitoring is essential, as the medication can affect renal function and lead to hyperkalemia, a condition characterized by elevated potassium levels in the blood. These potential side effects necessitate a collaborative approach to care, involving regular follow-ups and blood tests to ensure the safe and effective use of Entresto. Dosage guidelines for Entresto. Navigating the proper use of Entresto involves adhering to specific dosage guidelines, tailored to individual patient needs and clinical scenarios. Initiation and adjustment of the medication must be approached with precision, taking into account factors such as blood pressure, kidney function, and concurrent medications. The starting dose is determined based on these parameters, with gradual titration aimed at reaching the target dose recommended for maximum efficacy. Patients transitioning from ACE inhibitors or ARBs to Entresto should observe a washout period to minimize the risk of adverse reactions. This careful management underscores the need for close monitoring by healthcare professionals during the initial phase of treatment. Adherence to prescribed dosages is paramount, as it balances the benefits of Entresto with the potential for side effects, ensuring optimal outcomes for patients. The role of healthcare professionals extends beyond prescribing the correct dose. It also involves educating patients about the importance of adherence to treatment and the potential need for dose adjustments based on clinical response and tolerance. This collaborative approach fosters a therapeutic partnership, empowering patients to take an active role in managing their heart failure. Dangers associated with Entresto. While Entresto is a cornerstone in heart failure management, it's critical to be cognizant of the dangers associated with its use. The medication carries a boxed warning regarding the risk of fetal toxicity, advising against its use during pregnancy due to the potential for harm to the developing fetus. This warning highlights the need for effective contraception and prompt discontinuation of the drug if pregnancy is detected. Interactions with other medications present another layer of complexity. Entresto should not be used concomitantly with ACE inhibitors or within 36 hours of the last dose of an ACE inhibitor. The combination can increase the risk of angioedema, emphasizing the importance of careful medication reconciliation and patient education on the risks of polypharmacy. Lastly, the risk of abrupt discontinuation should not be overlooked. Patients should be counseled against stopping Entresto without medical advice, as sudden withdrawal can exacerbate heart failure symptoms, leading to potential decompensation. Awareness and understanding of these dangers are essential for safe and effective treatment with Entresto. Precautions and warnings when using Entresto. The journey with Entresto is one of cautious optimism, underscored by a set of precautions and warnings designed to safeguard patients. Prior to initiation, a comprehensive assessment is necessary to identify any contraindications, such as a history of angioedema related to previous ACE inhibitor or ARB therapy. This preemptive approach minimizes the risk of adverse reactions and ensures the suitability of Entresto for each patient. Regular monitoring of kidney function, electrolyte levels, and blood pressure forms the cornerstone of safe Entresto therapy. These measures help in early detection of potential complications, allowing for timely intervention. Patients should also be educated on the signs and symptoms of adverse effects, including hypotension and angioedema, and instructed to seek immediate medical attention if these occur. Engagement and communication between patients and healthcare providers play a pivotal role in navigating the precautions associated with Entresto. This partnership facilitates a tailored approach to treatment, adjusting dosages and managing side effects in a way that aligns with each patient's unique health profile and needs. Alternatives to Entresto. For patients who may not be suitable candidates for Entresto or those who experience intolerable side effects, exploring alternatives is essential. The landscape of heart failure management includes a variety of medication classes, such as ACE inhibitors, beta blockers, and mineralocorticoid receptor antagonists, each with its own set of benefits and considerations. The choice of alternative therapy depends on individual patient factors, disease severity, and response to previous treatments. Emerging treatments and ongoing research continue to expand the options available for heart failure patients. Advanced therapies, such as SGLT2 inhibitors, have shown promise in recent trials, offering additional avenues for those unable to tolerate Entresto. The decision to pursue an alternative treatment should be made in consultation with a healthcare provider, taking into account the latest evidence and clinical guidelines. The availability of alternatives underscores the personalized nature of heart failure treatment, emphasizing the need for a tailored approach that considers the patient's overall health, comorbidities, and treatment goals. Navigating these options requires an informed dialogue between patients and healthcare professionals, one that balances efficacy, safety, and patient preferences. Conclusion: Entresto has emerged as a transformative agent in the battle against heart failure, offering hope and improved outcomes for many patients. Its common applications, benefits, and the considerations surrounding its use reflect the complexities of managing a chronic condition like heart failure. While the journey with Entresto may be fraught with caution, the potential for a better quality of life and extended survival is a powerful motivator. As we continue to explore the full potential of Entresto and other treatments, the emphasis remains on personalized care, informed decision-making, and a proactive approach to managing heart health. For patients navigating the challenges of heart failure, Entresto represents not just a medication, but a beacon of hope on the journey towards improved health and well-being. In conclusion, delving into the intricacies of Entresto's use in heart failure management reveals a landscape marked by both promise and caution. By staying informed, engaging with healthcare professionals, and advocating for comprehensive care, patients and caregivers can navigate this journey with confidence, embracing the possibilities that Entresto and future advancements may hold.